Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Federal government launches SME clinics to help businesses affected adversely by the COVID-19 pandemic. Later on the program, public health physician and pharmacist Dr. Nzabasi Akanem addresses infodemic associated with COVID-19 vaccines. And 100,000 COVID-19 related deaths in India take the toll beyond 400,000. According to the World Health Organization, infection rates are doubling every week and the virus is spreading faster than previous records. The body has warned that a third wave of COVID-19 infections is inevitable if citizens are not disciplined. We begin with the WHO Regional Director for Europe. He says the 10% on the continent is taking place in the context of a rapidly evolving situation, a new variant of concern, the Delta variant, and in a region where, despite tremendous efforts by member states, millions remain unvaccinated. In Africa, WHO's Regional Director for Africa, Dr. Mashidiso Moeti, reports that the speed and scale of Africa's third wave is like nothing we've seen before. The rampant spread of more contagious variants pushes the threat in Africa up to a whole new level. More transmission means more serious illness and more deaths. So everyone must act now and boost prevention measures to stop an emergency becoming a tragedy. Meanwhile, according to the NCDC data, 29 people recovered from infections on Thursday, while one person died of COVID complications. 6 states and the FCT recorded new cases. Let's take a look at the situation report.
In the last 24 hours, the Nigeria Center for Disease Control announced 74 new cases reported from 9 states and the FCT, just 1 case less than the previous 24-hour cycle. Lagos recorded the highest by far with 49 new cases. Ondo recorded 12. Oyo and River State had 3 cases each. Kaduna recorded 2, while Ekiti, Gombe, Jigawa, Ogun and the FCT recorded 1 case each. Data from Jigawa State includes 1 case from June 30th, and Sokoto State did not report any case in the last 24 hours. The total number of confirmed cases of COVID-19 is now 167,692. 29 persons have been discharged in the last 24 hours, raising the total number of recoveries to 164,273. According to the NCDC, there are no cases on admission in Edo, Enugu, Nasarawa, Imo, Bauchi, Taraba, Sokoto, Yobe, Cross River and Kogi states. There was 1 death from COVID-19 complications in the last 24 hours, bringing the total to 2,121. Currently, there are 1,298 active cases in the country, and over 2 million samples have been tested so far. The Africa Center for Disease Control reports that Nigeria has administered over 3.4 million doses of the Oxford AstraZeneca vaccine in 2 rounds of the exercise. In Africa, there are over 5.3 million confirmed cases of COVID-19 and more than 140,000 deaths on the continent. Globally, there are now more than 182 million confirmed cases, while deaths have surpassed 3.9 million.
The federal government has introduced MSME clinics to help businesses negatively affected by the coronavirus pandemic. Vice President Professor Yemi Osinbajo confirmed this while speaking at the official launch in Jigawa State, northwest Nigeria. According to him, the pandemic has had a devastating effect on small businesses, which is why the federal government is introducing programs to assist the businesses. Vaccine misinformation and rumors about the so-called side effects of the coronavirus vaccine are rife. From supposed microchips, there's the altered DNA states and even links between the COVID vaccine and fertility being thrown about. Fake news seems to be spreading online about the vaccine faster than it was invented. Well, joining us to talk more about this, Dr. Incentivizing Ekenem, public health physician, also a pharmacist. He joins us via Zoom. Thank you for joining us on the program.
Hello, good evening, and thank you for having me.
All right. I mean, how do we protect communities from misinformation?
Okay, it's about infodemic management. I mean, at times like this, you are going to see more of, rumors making the rounds because there's a lot of information around COVID-19 being a new disease or a new epidemic. What we need to do in order to handle this is to make sure that we approach it in three steps. Number one, we provide adequate information using all the channels of communication. Two, we update people on information. If there are updates about information regarding COVID-19, we must make sure that we provide it in real time. Number three is to ensure that we track misinformation and then provide a very, very scientific explanation to any occurrence following, the COVID, whether it's the COVID-19 disease or the vaccination program. Now, as far as the vaccine is concerned, you know that before this vaccine was rolled out, a lot of persons had issues with how fast the vaccine came up. And again, people also had issues with regards to the safety of the vaccine. So it is more important for us, given these realities, to ensure that people are updated with real-time information about COVID-19 vaccine, because a lot of persons, in as much as a lot of us want this pandemic to be over, some persons also want to discredit whatever effort has been made by public health officials. So it's important that we use all the available communication channels to pass on information to people and then update them. Should there be any updates or any new developments, we need to update it in real time so that we can close the gap and not allow people with the wrong information to go ahead of us. So it is important that we go ahead of these people by ensuring that we provide information as it occurs.
All right, Dr. Ekenem, I mean, it's noted that online channels, particularly social media, tends to be the most trusted source of information among vaccine skeptic groups. And, we are seeing several videos going viral about perhaps those who have taken the vaccine becoming magnetic and, sort of everything they attach on their arm, it just sort of sticks. I mean, we're seeing like this video that's showing right now looking like someone's phone. His phone is on his upper arm and, seeming to be sticking together, or even a key. For some others, it's something else. So a lot of people are saying, are wondering exactly if this is true, or if the rumor that COVID-19 vaccines make you magnetic is actually the real deal. But, we essentially cannot verify these videos and how all of this things appear to be sticking to different people's arms. And it's not just, in Africa. We're seeing it in Asia, in several other regions across the world as well.
Okay, let me put it in context. When I saw this video, the first thing I did was to make a call across to a few persons that I know that have taken this vaccine. And I actually told them, just to be sure, to carry out this same activity, pick up a metallic substance and also attach at the point. A number of persons that I actually call, I don't want to talk about myself, but let me say that the people I called, they did this same thing and it didn't happen that way. So it's not unfortunate that people have abused the social media, because if these things happen, I'm not here to discredit that, okay, it did not happen. But I'm telling you that from the people who I have called, none of this ever happened. But I would say that if these things are observed, there are proper channels of passing this information. This is what we call, this could be one of the things that we call adverse events following immunization. Now, if these things occur, rather than go to the media and, discredit the entire vaccination campaign, why don't you probably go through the properly investigated. We cannot depend on things on the social media as a verified source of information. No, this has to be investigated, which I believe that it will be investigated. And if we realize that there is a link between these occurrences and the vaccine, it will be communicated with the public. But for now, I would urge the public to disregard this information until it is proven by health officials, by the World Health Organization, and of course by the National Primary Health Care Development Agency in Nigeria.
Indeed, but while we're still waiting for them, some would say the damage has already been done. YouTube, for example, is reported to have removed almost 100 videos related to dangerous or misleading information about COVID since February 2020. But let's talk about incentives. Lots of other countries are giving incentives to their citizens to taking the vaccine. Do you think this is something the government here needs to look into?
Absolutely, absolutely. Incentivizing vaccination program is not just did not begin today in Nigeria. There's on new incentives. I know that they provide incentives and to who bring their children for me. I feel that we should adopt the same strategy. And to where the immunization program is being conducted, subsidy, to help them, transport themselves to places where. I believe that if we provide incentives, whether it's more in time, it will help, to rekindle the interest of people, in taking this vaccine. I think that it's a very fantastic approach that can help people to see the need, of getting this vaccine. Yes, it is a good thing to get the vaccine, but people do not really understand the importance of vaccine. So every opportunity that presents itself, we can utilize this opportunity, to increase the number of people that go for this vaccine. And one of such strategy could be, giving incentives to people who take the vaccine as an encouragement to others who are still hesitant, so that they can also go and take the vaccine.
All right. We appreciate your time on the program. Thank you so much, Dr. Nsebase Ekanem, public health physician pharmacist. Thank you for joining us on the program.
Thank you for having me.
The head of South Africa's Medical Research Council says data from laboratory studies show Johnson & Johnson's COVID-19 vaccine works well against the Delta variant that now dominates new infections in the country. Penny Moore, a professor at the National Institute for Communicable Diseases, said that all data collected suggested that the vaccine should work against the Delta variant. Johnson & Johnson said that its single-shot vaccine showed strong promise against the variant and other emerging strains.
A couple of questions that I'd like to try and answer. The first is, do the vaccines work? And I think we want to reiterate that all the existing data that we have, laboratory immunogenicity data, effectiveness data, suggests that the vaccines that we have will work against the Delta variant.
Well, speaking of the World Health Organization now, it is advising the International Olympic Committee in the run-up to the Tokyo Games opening later this month. It's urging caution so as to stem the spread of COVID-19.
Thank you.
We've met several times with the IOC for the Olympic Games, but we do know that even small gatherings like backyard barbecues, if the virus is circulating and you don't take the proper precautions, the virus can spread. The IOC and others have outlined their plans in taking the approach for the Olympics, and we've been engaging with them and advising them on the best use of those plans. We are learning from Euro 2020. We are learning from many of the different events, whether these are religious-based events, whether there are events that are happening related to political rallies. If the virus is present and precautions are not in place, the virus will spread.
We have more on the global update when we return. Please stay with us. Welcome back. The EU has introduced a traffic light system for a better overview of the epidemiological situation in individual member states. 3 colors, red, orange and green, denote high, medium and low risk areas in the bloc. Grey regions signify areas where insufficient data is available. Now, across Germany, coronavirus infections have been falling drastically, dropping to a mere 9 cases per 100,000 residents within 7 days on average. All travelers to Germany must present either a negative test result, proof of vaccination or documentation proving recovery from COVID prior to departure. And it appears that authorities there accept PCR, LAM, TMA and antigen tests. Well, in the meantime, Delta remains the topic of the week, as health officials warn the variant is likely already dominant in Germany. Well, Chelsea Delany, Deutsche Welle correspondent, joins us now from Berlin for more on this. Hi, Chelsea. I mean, Germany is considering new travel rules as the Delta variant takes hold across Europe. What could change?
Well, one thing that definitely is going to change is that Germany is ramping up controls at entry points like airports and external borders. This was announced yesterday by the German Interior Minister Horst Seehofer. They also want to have local health offices step up their enforcement of things like quarantine orders. In the past, many people who have been required to quarantine say that no one ever really checked in to make sure that they were actually doing it. And that is obviously a big infection risk. So increasing monitoring to make sure people are actually following the travel rules is a big priority for the government right now. But perhaps one piece of good news is that Germany is also now considering changing its classification for both the UK and Portugal. Right now, travelers from those areas face the strictest quarantine requirements, a 2-week quarantine. But the German health minister has said that they could actually reclassify them as risk areas instead of variant areas, which would mean less strict quarantine requirements. So I'd say all in all, Germany is responding to this rise in Delta with tweaks to its existing policies, but not necessarily major new restrictions.
We've heard the World Health Organization warn that Europe is at a risk of experiencing a 4th wave of infections. I mean, how close is Europe to this new outbreak?
Well, it really varies from country to country here in Europe. In Germany, for example, infection rates remain very low and, in fact, have been declining. Today, there were about 890 new cases. So even though our Public Health Institute does estimate that Delta is the majority of cases now, it doesn't necessarily seem to be leading to a big outbreak in new infections. Other countries like Portugal, though, are having a much harder time with this highly contagious Delta variant. So we've seen Portugal reinstate things like curfews and travel restrictions, but other countries like France have also been deciding to delay some reopening steps because of Delta. And more broadly across the European continent, cases rose by about 10% last week, according to the WHO. And they are warning that this could lead to a 4th wave of infections by the fall. What all health leaders are really stressing right now is vaccinations. There's been a lot of research in the last few days showing that vaccines do protect against the Delta variant. So there is hope that if vaccination rates remain high, this 4th wave could be avoided.
Finally, Chelsea, the EU's vaccine passport meant to enable free travel throughout the bloc went into force July 1st. How is that working so far?
Well, there have been some hiccups. This digital vaccination certificate was meant to make it pretty easy to travel throughout Europe for Europeans. And the idea is that you get a QR code on your phone. It shows your vaccination or testing status, and you can show that at border controls throughout Europe. The European Commission says that already around 200 million people have one of these certificates because some countries were doing a soft launch of the program leading up to the official launch yesterday. But there already have been reports of issues. Perhaps the biggest functional problem is there isn't much of a control system in place to make sure that the vaccination certificates are actually accurate. A security group here in Germany tested this out and was able to register a fake vaccination certificate to Robert Koch, which is a famous German microbiologist, for the year 1843. Obviously, that's a fake vaccination, and there really weren't any accuracy checks to prevent that from happening. So that's going to be a major concern as this is rolled out. Airlines as well have been warning that this could cause some travel chaos as countries are now implementing this in very different ways. For example, how many times and where these vaccine certificates are being checked at airports really varies throughout the EU right now. So there are likely to be some teething problems as the kinks are worked out of this system.
All right, Deutsche Welle correspondent Chelsea Delaney, many thanks for that update. Now, India has reached the grim milestone of 400,000 deaths from the coronavirus, half of them during a second wave in the past few months that overwhelmed the healthcare system and crematoriums. India has recorded 30.45 million cases since the outbreak of the pandemic last year and is the second most affected country behind the US, which has 33 million cases. Here's more on the global update.
India, the world's second most populous nation, recorded 853 deaths in the past 24 hours, Health Ministry data showed on Friday. That took it past the 400,000 mark, with the last 100,000 being added in just 39 days. But health experts believe India may have undercounted deaths significantly, and the actual number could have reached 1 million or even higher. Over in Australia, Prime Minister Scott Morrison says Australia will halve the number of international arrivals into the country to ease pressure on its hotel quarantine system as the country battles to contain outbreaks of the Delta variant. Australia will only receive about 3,000 overseas travellers, and lowering the caps on will be finalised by July the 14th, though some states can move earlier. South Korea's daily count of coronavirus cases has topped 800, the highest in nearly 6 months due to new cluster infections and the spread of the highly contagious Delta variant. Authorities are particularly concerned about a new outbreak traced to an English language academy just outside the capital, with at least 242 cases, including the Delta variant, confirmed there. German Health Minister Jens Spahn has announced measures to boost the effectiveness of the country's vaccination program against an expected wave of the Delta variant of COVID-19, which is more infectious. The health minister says that it will in future be possible to combine the first shot of the AstraZeneca vaccine with a second shot of mRNA vaccine like those from BioNTech, Pfizer or Moderna. British Prime Minister Boris Johnson said he does not plan to order a reduction in crowds attending the remaining Euro 2020 football tournament matches due to take place in London's Wembley Stadium. The World Health Organization said on Thursday that crowds at the Euro 2020 stadiums and in pubs and bars in host cities were driving the current rise in coronavirus infections in Europe.
Around the world, more contagious variants like Delta Plus are spreading and a lot of people are still vulnerable. Don't forget to protect yourself, continue to take responsibility. You can visit our website for more updates, a better understanding of the pandemic that's still taking place around the world. You can find other stories there as well at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.